Stop. Cool. Hi.
Great.
We are
Hi.
live. Hi. My name is Amanda. How are you, Donna?
I'm just fine. How are you, Amanda?
I'm fantastic. Well, my name is Amanda. I am here with COVID-19 Long Haulers discussion group. Introduce yourself, friend.
I am Donna Zelesny, and I am also with COVID-19 Long Haulers Group. Yeah,
Yay.
but not quite as long as Amanda.
Almost as long. You were there almost from the beginning. So
Yeah, yeah.
yeah, we are co-admins of the discussion group on Facebook. Today, we are going to be talking about patient self-advocacy. And if we have some time, I'll be monitoring for questions, so I'll take a look at that because I love multitasking, right, Donna?
I'm glad you do.
Yeah, somebody
Right?
should. I don't always do it well.
Yep,
Okay,
not
well,
my
let's just
fault.
start right off. We'll go through our outline here, and then we'll watch for questions, okay?
All
Or I
right.
will watch for questions. What should I do
Right,
to
right.
what should I do to prepare to see my doctor? Go for it, Donna. I'll let you start out here.
Okay. First and foremost, make yourself a list of your symptoms so that you can support whatever it is that you're telling your doctor. Don't be specific, be concise. Don't just say, I feel bad. It's not very helpful.
Yeah.
Are you nauseous? Are you dizzy? Are you aching? What's going on? And describe your pain. Is it sharp? Is it dull? Those are all questions they're going to want to ask you so that they can get the best information possible and come to a better idea of what's going on for you. If it's helpful, you can track your symptoms on one of the apps that's available. I think somebody mentioned Dailyo as being one that you can
That's a good
do.
one. Yeah.
You could even just pencil and paper journal if you want to. For me, that has challenges, and maybe for others too, writing things down is not always as easy as it could be. I like an app called Visible. It's got a freebie symptom tracker on it that you can fill in your own symptoms and track that. But there are other things out there too. If that's helpful for you to keep a list of what's going on and when things are different, that can show trends to your doctor, that can show severity to your doctor, and that can be helpful for you. And I mean, also, if you are away from your phone or your journal or whatever, post-it notes.
Yes.
I live with post-it notes.
That's right. Yeah, this is my COVID Bible. I keep everything COVID
Yes,
related in here. Yeah, I
yes.
keep post-it notes all around the place, and I just pop them in here later on.
Right. I mean, I usually carry a little calendar with me too, and that's, I sticky the
Yeah.
page that I need for that day
Yeah.
with all
Cool.
my
Real old
little
school.
goodies on it. Yeah, except for, of course, you have to remember to write it down and be in the space where you can write it down,
Right.
but that makes it easier to be able to do that.
Yes.
And
Yeah.
if you don't have the executive function to get those things transferred into a journal, I love the idea of your little COVID Bible, whatever. I have a manila folder that I will carry around too sometimes, and sometimes it's just stickies listed in the manila
Yeah.
folder. And as we're talking, whoop, off they go, you know, because it's important to convey that information however you can most easily do it. You have to be
Yeah.
kind to yourself as well,
Right. Yeah.
because if you're stressing over what did I forget? What did I forget? You will not be able to focus completely on what the doctor is saying to you or PA or whoever it is that you're
Yeah.
seeing.
Yeah.
So yeah,
Yeah,
it's
and I
always
like
nice.
that idea of like to make a list. It's okay. Like executive dysfunction is a very real thing. Even before COVID, it was like I need a list.
Yeah.
It's even
Right.
handier now. I have a list everywhere. This is
Right.
supposed to be like a journal slash planner slash. Yeah, you can see this mess. I just jot. I don't even use it for the calendar purpose on here. I just pick it up and like jot things down in it as I think of it. It's okay to be a hot mess. Just get it down because you'll probably forget it later.
Right. It's much better to be a hot mess than a forgetful hot mess that leaves her
Yeah,
information out completely. So,
yeah,
and one of the things that helps me do that better when I'm in an appointment is making sure that I have rested well the night before, or as well as
Oh
possible.
yeah, right.
Sleep dysfunction is a thing too, but
It is.
as well as you can rest, kind of keeping it low key before the appointment so that you don't have a lot of stress running back and forth and going into it.
Right.
Then making sure I've had a snack or something if I don't have
Oh,
fasting blood work coming,
hydrate.
and hydration with electrolytes for the potsies
Yeah,
or whoever needs it.
that's right. We're trying to model behavior right now, which is not something I would normally say of myself. So, so hydrate.
This is a really good one to model.
It is. Yes. Do
Hydration
that.
is super important. Using the restroom if they don't have to do a urine sample, just making sure that there are as few distractions as possible. Putting your phone on mute, like no calls,
Yeah.
silencing, your alarms and stuff so that you don't get disrupted.
Yeah.
But if you are bringing your phone in anyway, and most people usually do, and you have symptoms that you cannot easily describe in your journaling, physical symptoms like swellings or rashes or weird brown spots or whatever, COVID toes, pictures
Picture.
can be helpful.
Yes.
Yeah, pictures can be helpful. So you can certainly discuss that symptom and then pull up a picture and say, look, this is
This.
what this looks like. And that gives them a better idea of what it
Yeah.
looks like.
And
Because
it's well.
symptoms can be so transient. I mean,
Yeah.
one day there's a bruise, one day there's not. So
Yeah.
it's
Or if
helpful
you've
to
got a
have
wearable,
documentation.
if you've got a
Yes,
wearable device, or I've got a pulse oximeter that it plugs into my phone, and
hmm
it actually records my pulse and my O2 sats over time. I can
right.
just sit there and pull up charts in this little app that comes with it and show my doctor, hey, check this action. I got down to 62 and stayed there, bro. And he's like, whoa.
Oh, not good.
Yeah,
Yeah, the wearables are really super helpful.
they are.
They often will come with a cost of some sort, fee for the app, fee for the device,
Yeah.
whatever. So it's a little harder for folks on a budget.
Yeah. Well, the one that I have, the only cost is just it's like I think it's $44 for the pulse ox, and that's it. The app is free.
Yeah,
So it's a little bit pricier than it's about twice as much as like just your run of the mill pulse oximeter, but it's really good. I've really been impressed with
yeah.
it.
The
So
logging capacity is really, really helpful.
yes, oh my gosh,
Yeah.
yes, and it shows it in like in a chart form, and it's a lot easier. It's a very visual thing where I can show my doctor, hey, check this. And there are times where my heart rate is just like this.
hmm
I can show him,
hmm
yeah, this is what, and I try to take note of what was going on at the time, so that I can say, hey, I was doing this really weirdo thing, or I was just sitting down on my couch,
Right,
whatever. It's really
right.
important to take note of what you're doing at the time too.
Yep.
And we have, and I was gonna touch on this later. Might as well do it now. We have these little advocacy cards that I've been making. On one side, it has a QR code, and I've got them in six different flavors. Like this is an endocrinology one, and the
Ooh,
QR code links to a literature review of a whole bunch of different endocrinology-related long COVID studies. But the backside, this is really great. It's got 3 lines where you can write down the 3 things you want to discuss most with your doctor. And we'll get to this in a little bit as to why just 3 things. You don't want to go too in depth.
right.
And there's a little space where you can write the date and time of your appointment. So you take it in
Handy
with you,
dandy,
hand it to your doctor, and be like, hey, scan this, bro.
right? That is super handy. I
Yeah,
love that idea.
yeah. It's because I get it and I'm like, no, I'm good. How are you?
No.
No, don't do that.
Yeah,
Write it
right.
down. Don't
Yeah.
model that behavior. Write it down.
Write it down.
Yeah.
Yes. Yeah,
Um,
that's great.
and we're kind of all over the place with our little outline here, and that's okay too.
That
Um,
is
yeah.
okay. That
If
is
you
okay.
and if you're struggling with a lot of these things, ask for help. You can ask for help. There are often resources available to you that you might not even know about, including care coordination. I went through behavioral health at the system where my long COVID clinic is. Um, they have all kinds of services, and it's really been helpful. I had to stop driving a couple of years ago, and when they're available, my case manager will come and pick me up and take me to my appointment. They're not always available, but there are all kinds of things out there.
There
And
are.
if you're in a rural setting, it might not be the same as you are if you're like in the middle of the city.
Right.
But talk to your doctor about that. And if your doctor doesn't know, ask, hey, maybe call your health department, call if there is a behavioral health anything around you. Start there.
Yeah.
There are probably more resources than you think.
Right. And I think some insurances still maybe offer nurse case managers as well
Yeah,
for people who have really complex care, managing a
yeah,
lot of specialists and really need some help keeping that
yeah,
stuff organized and in their brains, and making sure they're going the places they should be that are most
yeah.
helpful.
Exactly.
Yeah.
And if you don't understand, if you're in your appointment anytime, you don't understand, stop and ask questions. It's okay. You don't want to get out the door and realize, I don't know what just happened. Ask questions.
Right. If
Yeah,
it's possible and you have, an advocate with you or somebody that can come with you to an appointment and help you
yeah,
hear things and jot down notes for you, that's awesome.
yeah,
Um, some doctors will allow you, if you ask, to record an appointment, and that way you've got some of what they say
yeah,
on your phone, but please ask permission because a lot of
yeah,
them don't care for that.
yeah,
So you really have to do make sure you have
yeah.
permission.
And
But
you want to make sure it's legal in your state as well. So,
okay, yeah. And so that can be helpful if you're having trouble doing the note taking yourself or
yeah,
making sure that you understand everything yourself. But like you said, I mean, don't leave the room until you know that what they've said to you makes sense to you, that you
yeah,
can understand what was said, particularly if there's long medical terms that have
yeah.
bizarre spellings that you need to look up later.
Right? Yes.
Make sure that they put that on your after visit summary or whatever it is you
Yeah.
get at the end of your appointment. Make sure that you have that information so that you can look up things later if you don't
Yeah.
understand what you've heard, or
I think
if you're not sure about a term
yeah,
in particular.
acinetobacter, xylus oxidans. What? The first doctor who when I did transcription, the first doctor who laid that one on me, he was like, "I'm sure you know how to spell that, sir. Excuse you."
Sure, I do.
Whatever. Oh my gosh,
We'll whip out
it
the
was a
work
cystic
manual.
fibrosis clinic, and they're like, "Oh yeah, you know how to spell that." What?
Yeah.
Okay.
Okay.
You
Sure we
have
do. Sure we
you have
do.
faith, I do not.
Yes.
Yeah,
Um,
and
go
well,
ahead.
and it's also if you're not comfortable with that doctor, or if maybe you've come to a certain point where neither of you is really sure where to go next, or if something is not working for you, it's okay to ask for a second opinion. And in some, even in good circumstances, a second, or a third, I guess, a third set of ears in
Mhm.
that situation might help. It's okay. And that's something you can talk about with your care provider. It's not something that they're going to be offended by. It might be that, hey, they might want to talk to someone else too. Let's figure this out together. It's a collaboration.
Right. I know there's a lot of confusion in the medical community about, how do we
Yeah,
treat? What do we do? And yes, a second opinion is super helpful just because a different perspective can make a
yeah,
big difference in how the same information is interpreted. And it may be that, not just a second opinion on the same level as your primary doc, but like maybe going on to a specialist. Maybe it's time to
yeah,
see a specialist. Those are good questions to talk to your doctor about if you feel like they're kind of struggling a little bit to understand what you're saying and you need a little bit more than they're able to give. um, you know,
yeah.
I've known that there have been folks who've gone into the primary care doctor's office and said, I think I have dysautonomia. I feel really dizzy when I stand up and my heart races. And they go, well, we can't do a tilt table or anything. So,
Yeah.
probably you're just fine. Why don't you try drinking water? And
Yeah. Hey, let's
no,
check this out.
no. So yeah, another set of eyeballs would
Yep.
be helpful in that situation, in any situation, really, if you are confused or if you need more
Yeah.
input,
And
or
if
if you feel
things
like you're not being heard.
Yeah, yeah, if you feel like you're not being heard, if something is not working and you've just come to an impasse, it's okay to find another provider. It's okay to look into that. Because it needs to be a collaboration. If it's not a collaboration, you're not gonna get too far.
Right.
I've been having problems with one particular doctor. My case
Mm.
manager was with me at one point, and he was like, are they always like that? Yes, they're always like that.
Ooh. Oh dear.
So yeah, that was fun. It was so obvious that even the case manager was like, that's not right. I know. So
Hmm.
it's okay to find another provider.
It
It
is.
needs
It
to work
is.
for you.
It is. Give them a fair trial,
Yeah, do give them
a
a fair
couple of
trial. Yeah.
appointments. Well, okay, if they've
Give,
earned
yeah,
it.
give your example. Well, give your example. You have more patience than I thought I was a patient person. Man, go for it.
But well, okay. I have two examples actually. When I first got sick and we were trying to track down the heart stuff, and my cardiologist, the first visit, I walk in and she's like, "Well, I think you just have anxiety." And that is my trigger.
Yeah.
Because I've never had anxiety. I am so chill. And I wasn't anxious. I'm like, I am laying on the couch and my heart rate is 170. It's not anxiety. It really isn't. Can we look into more things? Um, and she said, well, I think, we'll just, I think you're anxious and maybe you just need to calm down.
No, they would.
We're
Yeah, no.
not going to leave it like that. I said, I think I'm anxious. I'm not anxious. I don't have anxiety. I am concerned that I am being misdiagnosed and I have significant heart problems right now that are not being tended to. I was trying to be respectful. I was trying to be very clear about it. And she received that message and did do further testing, which did come back with a diagnosis of inappropriate sinus tachycardia. So there was something there
Yeah,
that would have been dismissed and missed
yeah,
for a little bit longer. And I didn't really want that. So it was
yeah.
good that she listened. And when I went back to her, gosh, like a year later, just before I moved from that city, she said, I wanted you to know that you were the first long
Oh,
COVID
wow,
patient I'd ever seen. And I had no idea that that was a thing that could happen.
wow, yeah.
So you can be an advocate for yourself and educate your doctors as
Oh,
well.
yeah,
They
definitely.
they know a lot more now than they did, and I know that some people are
Yeah.
going to laugh at that and be like,
Oh,
"Not my
try
doctor."
not. I'm surprised. Yeah,
But it is true. There is more information out in the general base now than there
yeah.
was. My second
Oh,
experience was that when I moved into my new home and I was looking for a primary care doctor, I walked into this office and thought, okay, this is the gal, this is going to be the one, this is it, which is a really bad thing to tell oneself when you're
yeah.
interviewing new
Don't
doctors.
do that.
Don't do that. So I filled out all the paperwork and did all of the medical history and the medication lists and stuff, which is formidable at this point because
Yeah.
long COVID. And she looked at my chart and she said, well, I don't think this is you. I don't think you have any of these things. I think you're a bored housewife and you just need to get a job or volunteer somewhere. And I said, you know, I like to have my care team all kind of row in the same direction. And like, you're not even in my boat. So I appreciate you. Thank you for your time. Bye. And I never
Yeah.
went back because sometimes you can
Oh,
tell right away.
yeah.
The first doctor responded to my suggestion. The second doctor wasn't hearing anything other
Yeah.
than, you know, bored housewife, which
Wow.
it's some self-control.
Let's kick it back to 1950 with Betty Crocker. How about?
Right?
Oh
Yeah.
my
Took,
gosh.
took some
Oh.
self-control.
Yeah. I had to fire my first cardiologist. I gave him a couple shots. He was
Mhm.
like, "Well, I need to watch your anxiety," and I said, "Sir," and I was very respectful in my emailed reply. No.
Mhm.
And he came back a second time with anxiety, and I was like, "Nope." So, but I have a friend who's one of his colleagues. It's a really large
Mhm.
practice in a local system. I emailed his colleague and I was like, "Hey, who is the absolute best note taker in your practice?" And he said, "Dr. So and so." I said, "Cool." Dr. So and so's office called and said, "Okay, how can we help?" We set up an appointment and he asked me just, "Okay, what can I do for you?" And I said, "Hey, I am not really worried about these things, but I need you to take those findings that are being written off in my echocardiogram, put those down there so that they're being seen every time someone pulls up this report. Because right now
Right.
it's up in the body of the report. It's not down here. I need you to put it
Right.
down here." And he
Yeah.
said, "Okay." Um,
Yeah.
but I still am not impressed with this particular system, so I'm not even in that system anymore. I'm going through a different one now.
Mhm.
It just
But
was really,
records transfer.
they do
They're,
transfer, and it's really
they're-
important to also um, make sure, and this kind of skips down, I'm going to skip down here really
okay.
quick. You need to know how to read your chart. That's
Yes.
really, really, really important. And if you need help with that, please reach out. We're glad to help. We've got enough moderators and admins in this group. Just reach out, tag me. I will. Hey, hi. I might miss it the first time. That's cool too. Tag me again.
Right. Yeah. We're good.
Yeah, we will walk. Like a lot of you use my chart or Epic or
Mhm.
whatever, know how to get into it and access it. And with some of them, it doesn't matter if it's different facilities, different systems, they still use the same thing. And you can link those all. And that's what I've been able to do with mine. Even though it's across 2 cities and several different systems, I can
Right.
pull them all up in the same system. And I literally, with my endocrinologist, I was like, well, that thought, sir, 15 years ago, it said this.
That's
And I just
awesome.
handed my phone over to him. He's like, oh, okay, okay. Yeah, I've had this study done 3 times. Oh, you sure have. Yes, I have.
Yes.
Um, and
Yeah.
if you know what is in your chart, you can advocate for yourself even better. And if you have
Mhm.
questions about, hey, what does this mean? I don't know why my camera's out of focus right now. There, blurry, and it's not just my eyes for a change. Know what your chart says, and if you have questions about it, reach out to your physician's office, your care provider. I don't understand what this is. um,
Absolutely.
and it's really
And
important. Well,
look
if
for
you're,
mistakes.
yeah, look for mistakes. Yes, if you're sitting, and I do this when I'm in the ER every time I go in. Make sure you've got like an extra long charger. Bring your charger. Bring battery packs. Whatever. You can actually you'll probably be able to see the results of your labs and even your
Mhm.
radiology sometimes before the physicians do, because it's a freaking ER in the middle of a pandemic. Um, you can read these things as they come in, and you'd be like, hey, you said it was normal, but I'm looking at this, and this is a pattern that I've seen over time where this lab is
Right.
consistently off.
Right.
And and again, in an ER setting, that's a totally different town hall. They don't diagnose, they just stabilize, but take note, right?
Right. Right. But it could factor into your urgent issue,
It could,
whatever it
yeah,
is.
yeah.
Yeah. So, I mean, it is important to make sure that, they're seeing all the information that's relevant.
Yeah,
So,
yeah,
yeah.
and if you've got a whole slew, like a cascade of labs, and it can sometimes, and they're usually flagged or highlighted, like they're bolded, something, so that they stand
Right.
out. But it's important to see and know and understand what's in your chart.
Absolutely true.
Yep.
Absolutely true.
And I'm gonna skip that. Let's go down to the little starred thing here. Make sure you tell your doc every single med and every supplement you are on. Do not take, oh, well, it's a supplement. Y'all don't need. Yes, they do. Tell
If
them.
I had $1 for every time I had to spell quercetin to,
Gosh, yeah. Well, it's better
to the
than
doctors. Oh my gosh.
Siloxanes.
Yeah.
I Siloxanes.
Yes. Yes. You do. You have to list them all. They all have an
Yep,
impact, or
they do.
some can be significant.
Yeah, yeah. They could have different interactions with medications that
Mhm.
you might need to be tried on. They could be having everything you ingest will have a pharmacokinetic or pharmacodynamic impact, and
Mhm.
that's the impact that thing that you just swallowed. That's the impact that it has on your body, but your body also has an impact on that thing. And
Right.
it's really important to understand that when you start mixing things together, just tell your doctor everything.
Yes. All the meds, all the
Yep.
supplements. And maybe some folks are doing some of the various treatments and things that have popped up, kind of independent of medical facilities that you need to share that too.
Please do. Yeah, please do.
Please do.
Because there are some things, it can frankly just be dangerous. It can be dangerous if you're trying these things and you're not telling your doc.
Yeah.
Don't do that. Tell them everything.
Yeah. They need to know.
Yep.
Yes, indeed. And if
Even yeah, even if you're like if you're feeling bashful about it, don't just tell them.
right. And if you're I have some medications that adjust dosage with the day if I'm having more symptoms, I take a higher dose. If I'm having
Yeah.
less symptoms, so that kind of information is helpful too. That's stuff you probably ought to put on your little tracker,
Yes.
so that they can see, hey, I had an extra high dose today, or this week I'm taking 2 pills at night instead of one,
Yeah.
so that they know that can show severity to them as well. Hey, this person has now doubled their medication. It's still not
Yeah.
working. We need to try something else, whatever that else may be.
Yeah. Yeah.
Yeah.
Um, and let's get back up here. No, if something doesn't feel right, speak up and gently push back. It's okay if you're not comfortable with something, or if something just doesn't making sense. Maybe there's something that you're not thinking of. Maybe there's some context to the
Right.
situation. It's okay to ask questions or even to push back. Like with my cardiologist, you need to watch your anxiety. No, sir.
Right.
Not that.
Yeah, I agree. Done respectfully, but
Yeah.
confidently.
Yeah.
That is a very important part of the being an interactive
Yeah.
patient. It's your job to make sure that they know that you're not comfortable with that.
Yeah.
Um, yeah, otherwise you could be told to do all kinds of things that you're not comfortable with.
Yeah, yeah, and it could be it's not. It could be that they need context for something too. Like there might be
Mhm.
some piece of this puzzle that they're not factoring in. So
Right.
yeah, and sometimes there
Mm.
might be a mistake on your chart, and that's I will give an example here because it was a potentially dangerous mistake.
Mm.
There's a person in the group. I have taken them to the ER many times, and they were so incapacitated at one point I had to go in with them, even though it was in the middle of a big surge. They could not walk, they could not talk, and it was like, I'm
Mm.
going in. And the first thing out of my mouth as we were wheeling this person in, they are allergic to this, and this. And they said, okay, got it. And they put the little allergy band on, and they were taking notes. It was great. And I noticed when they gave this person something that was on the allergy list, and I was like, whoa, 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 no, yeah, what are you trying to do?
Right.
They handed me the paperwork at the end of the ER visit, and I looked on the allergies, and the two that they had an anaphylactic reaction to were both listed as anxiety, and I was like, whoa,
Oh,
no,
thanks. Yeah.
no, you
Yeah.
need to go back and fix this right now. If you see a mistake, say something soon, say it often, do it in writing. Do it in
Hmm.
writing every chance you get so that you have documentation. And you just keep pressing until you do. That's something that really that was a potentially fatal mistake on this chart
Right.
that was very not cool.
Right.
So
And it doesn't have to be that significant,
yeah, it
although
doesn't.
that is horrible and
Yeah,
really needed to be addressed right away. So
yeah,
I'm glad that you were there for them to do that. But
yeah,
usually you'll find just small errors,
yeah,
but those small errors can mislead the next person reading that chart.
yeah.
And then it can become a bigger issue. So, be
Hmm.
sure that when you have your after visit notes, or I get mine in Epic. I see the notes
Yeah,
of what the doctor wrote. I don't know what other systems do, but
mm,
as much information as you can get about what was written down
yeah,
in that visit will be really important to look over and make sure that it's not got those little errors.
yeah,
And then you do correct them in writing. Just send a note. Hey, by the way, wanted to let you know that, this thing isn't this thing.
yeah,
And
yeah.
can you please change that so that it's correct? Um,
Yeah, and that's another good reason to know how to go in and access your chart, how to read these things. And again, if you need help with that, holler. There are plenty of people in the group who are more than glad to help with that.
Absolutely. And I think most of those systems actually have a care line that you can
Yeah,
call that can kind of walk you through if it's a technical issue
hmm,
that maybe we don't all
yeah,
get. But yeah, or have a friend who is knowledgeable in that same system,
yeah.
or one of us. Yeah, absolutely.
And there could be things that are in your visit. Maybe sometimes it isn't transcribed. Like the doctor doesn't. They might forget about it as they're dictating it later on. Oh, hey, I should have put this in there. If there is something that you think is missing from that record, absolutely reach out. Hey, I forgot about this. Or if there's something maybe you forgot, just sorry, hold on. My TV, I don't know, my TV came unmuted. Like wow, I am hearing angelic voices, and I don't know what's
I,
going on.
okay, I thought it was me.
Sorry. Yeah, no. But yeah, if there is something that needs to be included in your record that maybe is forgotten by either you or your provider, just reach on out. It's
Absolutely.
important. It really is important. Even if it seems like a small thing, it's still important.
Right. And I remember a couple of times where I had mentioned issues that I'd had previously and a diagnosis that I may have had previously
Yeah,
before I was in the care of this doctor or this system. And those records didn't transfer over. So
yeah,
when that happens and they put, patient reports, so and so can't substantiate or whatever,
yeah,
then, that is kind of a cue for you too, as well. Hey, if I
yeah,
can get my hands on this record, I can take that back to them and make
yeah.
sure that's added so that that's actually considered. Because again, if it's
Documented.
in the
Yeah,
body of those notes, sometimes it
yeah. And
doesn't
things
get,
do get lost in the body of the notes.
yeah,
There,
they
yeah,
do.
especially with radiology. With radiology, what happens when they're dictating it? They'll often say, "Use my normal template, blah, add blah blah blah,"
Mhm.
and then at the bottom they'll say normal findings, and you may be looking back at the body and thinking, "Well, that's not normal." It,
Right.
in normal circumstances, it might be something normal, but these are not normal circumstances, so it's
Right.
okay to speak up and be like, "Hey, I noticed this." And it
Yes.
may be something that you don't need to be necessarily concerned about, but it's a pattern that we're seeing across long COVID patients. So it is important to point it
Right.
out.
Especially like rapid change. If you've gone
Yeah,
from a low level normal finding to a
yeah,
very high level normal, still normal, but much more significant finding
yeah.
quickly, it becomes significant just
It
because of
does.
that amount of time.
Yeah,
Yeah.
exactly. Um, and let's look. We'll go back up here. Lean into your support systems.
Uh,
Look for support groups where you can compare notes. I still remember when we first started the group, almost wow, almost 3.5 years ago.
holy
Um,
moly.
Everybody, and they still, when they join the group, there are still people from March 2020 joining the group who were just now like, oh, I didn't know this was a thing. It's like, oh wow, you have been struggling for almost 4 years and you had no idea. I'm so sorry.
Yeah.
But everybody says the same thing. I thought I was alone. I thought I was going crazy. Um, what is going on? And
Right.
it's not until we come into these groups and start comparing notes. Hey, my teeth are chipping and 300 hands go up. Me too. Oh shoot. Things you might
Yeah.
things you didn't even know were related to a COVID infection. So
Right.
yeah, look
Right.
for those groups. Look for and on every platform. There's a group on every platform.
I'm sure there is and multiple groups on every platform, and not
Yes,
everyone
many,
is
many.
for, yeah,
Yeah,
everybody. But and I was, kind of also thinking about that for the folks who are just now getting or being diagnosed with long COVID. The amount of information out there can be overwhelming
yeah,
because now you've got all of the information from 3.5 years of people going, what's going on?
yeah,
And so the search button is your friend,
yeah.
and you can narrow it down to posts on a particular topic. You may still get 100,000 of them, but you can narrow it down from the substantially larger number that you would have if you were just trying to scroll through 4 years of
Oh
our
gosh,
group.
yeah. Huh.
That would be
And
terrifying.
well, especially at Facebook, they keep changing how we can organize our information. Whether it's
Mhm.
and it kind of at this point, I'm like, it is what it is.
Right?
Search.
Yeah. Fine. Yeah, just search it.
Yeah,
Or start a new topic, ask,
yeah,
because people will answer with their experiences. I think
mhm,
we're so lucky. This group has been so good about being willing to share
yeah.
and embrace, the folks that are coming in with, oh, I'm so sorry to hear that. No, you're not crazy, because those are the first things that everybody says, I'm
Literally.
crazy.
But yeah,
Yeah.
when we did that documentary that came out in January 2021, my spam folder on Facebook and Messenger just at first it was all of Cuba, and I was like, why is Cuba
What?
messaging me? What's going on? And then someone sent me a picture of their TV, and I was on it, and I realized, oh shoot, it's the documentary. And then like all of South America, all of Africa, and everybody said the same thing. They thought they were the only one. They were just
Yeah.
alone. They thought they were going crazy. They had
Yeah.
no idea. They'd never heard of any of this. So, and there's still, no matter how connected we think we are, there's still people who are just now realizing, gosh, I've been sick for almost 4 years. I didn't know what was going on. And I'm really grateful to everyone in the group who and I do get messages from time to time. They're like, oh my gosh, sometimes I feel like I'm repeating. It's okay. We've all been there.
Yeah.
We all started at the same point.
Right.
So
Right. It is good to look back at the old posts. I know people do sometimes feel a
yeah.
little bit like, oh, I keep saying the same things. But there are people who, as they've improved or as their lives have gotten busier, no longer respond. So you don't
Yeah.
want to lose whatever input they would have had. It is
Yeah.
it is good to search as
Yeah.
well. As well.
Yeah, and it's good to see the things that we've learned over time as well. I kind of like it when someone comments on a post from 2021, like, hey, what's the update on this? Hey, let me tell you.
Right?
Yeah,
I like seeing those too.
yeah, yeah, or people that I haven't connected with in a while, where, oh, hey, I was thinking of you the other day. How's it going out there? That's pretty
Hmm.
cool.
It
Yeah,
is.
we're buddies. We're trench buddies, y'all.
We are. It's a community.
It really is.
It's a community. No.
Well, let's get. I'm gonna skip. I'm gonna
Okay.
skip the precautions thing. Let's go down here. How to approach your doc with confidence and respect. Take it away, Donna. What are your thoughts?
Okay. So for me, I think the basis of being able to approach my doctor confidently is doing research beforehand as much as I can. Whether that involves touching base with the group, here's what I'm seeing. Does anybody else see that? What do you think? Or whether that involves pursuing a new study that's come out. If I see that posted somewhere, hey, let's look through that a little bit more and see if I can pick out pieces that are relevant to me and follow up on those. That takes significantly more brain power and
Yeah,
more effort, which is still pretty fatiguing for me on most days. So
yeah,
I will try to like print out studies that are relevant to what I need, go through and just highlight a paragraph a day. And yes, I know.
I know.
So, but that helps me discern whether it's relevant to me specifically or whether it's, maybe more relevant for someone else.
Yeah,
So, because I
yeah,
have other pre-existing conditions that impact stuff. So,
yeah,
it does make a little difference, and that helps me feel my best about going into my doctor and saying, okay, here's what I see in myself, here's what I've seen in other people, here's some other experiences that are similar to mine, here's what the research says, how does that shape your opinion?
yeah,
And see what they have to say about that. And that inherently is respectful, because
yeah,
what you're doing is you're presenting the information, but you're allowing the doctor to come to their conclusion, whatever that might be. And when they share that with you, you then have the knowledge base to kind of dialogue that a little bit. If you're like,
yeah,
yeah, well, okay, but what about this piece? And then they can clarify, okay, that piece for you isn't relevant. That piece for you might be relevant if we did this or that. And it ends up being a much better dialogue
yeah,
instead of just being told, here's what's going to happen, here's what I think. um, and sort of leaving you out of the decision making process
yeah,
and feeling a little bit dismissed. That is never where you want to leave a doctor's office, feeling dismissed. So
yeah.
definitely, with some information behind you, that's going to help you be a little bit more confident, and that in and of itself will lead to a more respectful exchange, in theory.
Yeah, and if you
Hopefully.
know you've got an appointment coming up, this just happened actually today and yesterday. If you've got an appointment coming up, hey, say something in the group. How should I be prepared going in tomorrow? What has worked for you? What has not worked for you? So it was kind of funny. They were actually live messaging like, hey, they just did this. They just said that.
Yeah.
Not
They
and
were.
obviously not when you're actively talk. Hold on, let me talk to my Facebook friends. But no, it was kind of nice to get that instant update from this person. Hey, they just said this, I said this, and they said, oh yeah, yeah, cool. So
Yes, absolutely. It's nice to have a phone a friend option, isn't
it
it?
is, yeah,
Kind of,
it is.
yeah. And there's nothing wrong with that. If you were in the middle of an appointment and you're like, I know I'm supposed to be saying something about mast
Well,
cells
yeah.
or whatever. What was that thing? You know,
How did they go?
then if you've got 5 minutes while they're doing
Yeah.
something else, then you can maybe see if you can get a response. I
Yeah.
can't always guarantee it, but
Yeah. We will try.
we will try. Yeah.
Yeah, and definitely, like you were saying, Donna, learn about your condition, know your condition. There are a lot of really
Mhm.
good resources. When I was still doing transcription, I used the Merck manual online. There's a provider edition, there's a patient edition. Heck, there's even an edition for your dogs and cats in the veterinary one. Um, you don't need that one. Don't look at that one.
Not applicable.
Not actually. Don't do that. But yeah, try to understand your condition as best you can. Don't dive in too deeply. Don't start self-diagnosing. Dr. Google does not have a
Yeah,
license in your state or mine. Um,
right.
but yeah,
Some of these, go
learn
ahead.
what you can.
Yeah. Some of these conditions are confusing enough for the trained specialists.
Yeah, exactly,
And it's,
exactly.
all you can do is say, I feel like we're headed this direction, and then, get their input back. But
Hydrate.
hydrate. Mm.
I only saw that because I should have written hydrate like every other bullet point.
Modeling for your pleasure.
That's right. Yes. Oh God, no. And this is something that you brought up earlier. Don't close off an alley to investigate. If you see something that, hey, that guy sounds like me, or if it's something that, okay, you repeatedly keep hearing it, especially if it's if it's something where I don't think that's me, but if you keep coming back to it, investigate it.
Yeah.
Go look into that further. Maybe it is, maybe it isn't, but look into it. Don't be
Right.
closed off to an idea. Follow the breadcrumbs, like you said.
Right. Follow those breadcrumbs, because
Yep.
you never know. I mean, it may be that first idea isn't correct, but it led you to something else, which leads you
Yeah.
to something else. Don't close those doors on everything quite immediately.
Yeah.
Um, unless, I mean, unless it's obvious,
Yeah.
like you're not hemorrhaging or something, and
Oh yeah. Yeah. If
those
you
kinds
are
of
hemorrhaging, please call a medical professional. Like,
right. Please call 911. Yeah,
yeah.
but
That's
there
another
are some.
handle.
Yeah, you have so many of them now. It's amazing. I love it. These
It's a
town halls are great.
library.
They're great.
Um, and
But
bring a way
yes.
to, like you said earlier, bring a way to take notes of some kind.
Mhm.
I know some people, it like auditory processing is a little bit harder. Write it down. If writing it down is too much, maybe you could even, and again, like you were saying earlier, don't record unless you have permission, but you could always just
Right.
sit there like with voice recognition into a
Mhm.
Google Docs or something. You do what you can. Make sure you write it down so that you know later on. Take those notes and refer back to them later.
Absolutely. Absolutely. It's too easy to forget some of the details. I've
Yeah.
walked out of appointments and I haven't even hit the front doors. I'm like, what was the medicine
Right.
I said again?
Right.
No, that's not helpful.
No.
Not helpful.
And go in with realistic expectations. Ask for experiences in whatever group you're in.
Mhm.
Read through those experiences, but also understand when you're going. I see this a lot. And 10 years ago when I lost all my hair, I went in like every specialist was like, I'm on a mission. We're gonna get answers. On your first visit, you will not have answers. You will not have answers. You might find validation. You might find other paths to explore. Don't go in expecting answers right away.
Yeah.
But do go in prepared to explore these things with a provider. Okay, well let's figure out what tests we can run here. Let's collaborate on this. But don't set yourself up for failure by going in and think, oh man, that wasn't helpful at all. Um, and ha- Try to do as much reading and as much self-education as you can going in so that you don't come home feeling like, well, there's no answer for me. It takes
Right.
time and it takes patience, and that
Right.
it
It
sticks,
does.
but yeah.
It does. And sometimes that takes further intervention that takes labs or
Yeah.
tests or a second appointment, so that they can fine tune. I feel like if you have a positive interaction, especially on an initial visit, if it's
Yeah.
just a positive interaction, you feel like they're listening to you. Maybe they didn't give you any answers right away, but you felt like you were heard.
Yeah.
That's a good step. And then the next step, of course, is going to be, when do we follow up on that? How do we find out more? What do we do about this in the meantime?
Yeah. And it could be that specialist wants to rerun the same lab. It
Mhm.
could also very well be that the PCP doesn't have the specialist education that goes into you have to
Right,
run this lab a certain way.
right.
So when my endocrinologist was like, "No, we got to do it this way," I'm like, "Dude, I have done this like 5 times." But okay.
I ran across recently the scenario where my PCP did not have the codes to order a particular lab. They
What?
didn't. It wasn't even part of their thing. They were like, "We can't, I have no idea how
What?
to do
How
that."
do you not have a code? Oh my
Yeah.
gosh. That's
Yeah, they just
bizarre.
didn't have a code. Well, it was a special thing. I
Yeah.
actually, it was like, the tryptase levels when I was having my
Uh-huh.
anaphylactic thing. And they
Yeah.
were like, I don't know what that is. I've never heard of tryptase.
Oh
I'm
my
like,
gosh. Wow.
you're a doctor. That was
Okay.
my first thought. You're a
Yeah.
doctor. My second thought was, okay, I'm going to be respectful and I'm
Yeah.
going to speak confidently. Here's what's happening in this reaction.
Hey.
And this is the lab we need to show that.
Okay.
Which they didn't know how to do. So they sent me
Yeah.
to another lab,
Which
but
is what
that's
they should
okay.
do. That they
That's
should refer if they don't know, they
right.
should say, "I don't know," and refer you on. That's what you
Absolutely.
need.
Absolutely. And that ended up being a positive interaction
Yeah.
in the midst of a situation which could have been very not positive.
Yeah.
So um it is helpful to know what you need going in. It's and to have a little bit of grace there because
Yeah.
I mean, obviously, if it's not even in the system, she's typing in tryptase and it's not even in the options for her.
Wow. Yeah.
There's nothing else you can do with that, out you go.
Yeah.
So
And
on
it's
with this
really
one.
yeah. And like we were talking about earlier, there are times where a diagnosis won't really help, and in fact, it might mask other things that are going on. So, for
Absolutely.
instance, if you are going in to see a rheumatologist, rheumatology is like the collection of rule out disorders.
Yes.
For a lot of these things, there is no definitive lab. You do labs to rule out other things, or,
Right.
hey, if this comes back positive, it could be A, B, C, D, all the way through like 5 alphabets. Um,
Right.
but you certainly don't want to go in and be like, I don't know, fibromyalgia. And then there might be something else going on, and you're just passed
Right.
off as fibro. Like,
Right.
not to say that that is not, that is very much a legit thing, but you don't want to have it masking something for a long time when maybe there's something
Right.
explored.
Where it's all the doctor sees when you go in,
It's
that
fine.
if you've got a new symptom and they go straight to, well, that's probably your fibro, or
Yeah.
well, it's probably your lupus or your connective tissue disease or
Yeah.
whatever. And it's not, it's something else, it's different, but they don't see past the big
Yeah.
label. So it is sometimes better just not to have a diagnosis than it
Yeah.
is to have an erroneous diagnosis, or a diagnosis that's kind of all encompassing that diverts attention from what you're actually
Yeah.
experiencing.
And
Yeah,
it could be
rheumatology is great for that.
they are cleanup crew.
They
Rheumatology
really
is
are.
cleanup crew. We don't know. Go over there. And it could be that there is no definitive answer. There is no diagnosis. Like for 10 years, I've had alopecia.
Yeah,
And there has not been, until last year, there was nothing on the market to treat this. Absolutely nothing. Now there are 2 medications. It took
awesomeness.
10 years of patience to get to that point and was like, oh, shoot, got a feed to
Right.
cry. And my insurance doesn't cover it yet, but there are now 2 things. So,
Right. It's
um,
awesome. It's
yeah,
awesome. And I mean, sometimes it may involve uh, upping your level of care there,
yeah,
going to another specialist that's a little bit more involved in research or
yeah.
involved in the newest treatments.
Hmm.
Um, Maybe a university facility or something of the sort would
Yeah,
be a teaching hospital would be a better choice than a lower more community-based
Yeah.
care center. Um, I know that there have been some oddball things for me that were very unusual and hard to diagnose, and I ended up having to go to a major university hospital
Yeah.
to get a diagnosis. Totally worth it. 4 hours away,
Yeah. Yeah.
not all that great.
Yep.
So I don't do that often, but
Yeah.
it is, if you can manage that, if that's a necessity for you, if you keep ending up with, I I have nothing here. I don't know what I'm looking at. You've got to go see this person. And this, if you keep seeing that, make sure that that next person is a level up and understands a little bit more, if you can, or more experienced.
Yeah.
Um,
Or maybe not level up, but they're
yeah,
thinking differently.
right. Just
They
as
have a
long as
different context. Yeah.
right, a little bit different experience base
Mhm.
there can make a big difference. And sometimes it does have to be a higher
Yeah.
care center that just
And know also that there really might not be an answer right now, in that I I
yeah,
exhausted, I think, every system in this city with the
right.
alopecia. And
Yeah.
I would go into, okay, I still remember, and I did this with every appointment, like, okay, we're not going to stop here, we're going to do this, and
Right.
that's just from years of working in medicine. Like, okay, I know from doing this we need to go here, and they were great.
Yeah.
The best example was the first dermatologist I was referred to. I walked in, it was Botox posters, and I was like, this isn't gonna help.
Oh.
I was like, I was in tears when she came in. I was kind
Oh.
of angry too. She
Oh.
was so kind, and she came in. I was like, you know what? Before I waste your time and mine, I know you can't help. I know you can't. So here's what we're gonna do. You're gonna refer me to this, and I listed up 6 different things. She said, "You got it." And she walked me up to the front desk and said, "Don't charge her a thing," and went about my way and got into
That's
another system.
awesome.
Yeah. Um,
Yeah.
but even with all of that, even with exhausting every single possible test, every single
Right.
possible specialist, there were no answers 10 years ago. There are
Right.
now, and
Right.
I hope that we don't have to wait 10 years. But
Me
there
too.
are times where we just have to be patient with the science, and it
Yeah.
really stinks, but we just have to be patient with it. Um, and we
Yep.
definitely, when we're talking about long COVID clinics, I see this a lot where people are like, "Oh, they didn't know anything." If one doctor had all the answers, that they would be able to solve everything in medicine, and
Right.
that's a different town hall. I'm working on nailing down a date for that, but what to
Yeah.
expect in a long COVID clinic. They will
Yeah.
know how to triage you, but don't go into your first visit like expecting, oh, they're gonna have answers for me.
Absolutely.
Yeah,
Absolutely. Mostly they'll have referrals for you. And
yeah,
it does,
that's what it should be.
yeah, it does feel disappointing if you're
Yeah,
expecting answers, but it's progress, and that's important. And yeah, there's so many moving pieces with long COVID.
yeah,
It's not going to be something that we have answers for everything for a
yeah,
long time.
yeah.
Um,
And it
I'm not even
really,
sure.
right?
Yeah.
And it really stinks. We're the people going first through the jungle with machete, making the path. But
Yep.
each person who comes behind us, they
So
make it a little bit easier for the next person and the next person. And slowly we make progress. Slowly,
yeah,
but we've actually come a long way in 4 years, a really long way. It's been pretty remarkable. Um,
I agree. I
which takes
agree.
us to the last point. Um, Participate. It's
Yeah.
okay to tap out. If you are just like done, you're overwhelmed, it's okay to tap out. But it's important that as we are able, as we can, participate, because that's how we make progress. That's how we come to solutions, right?
Yeah, absolutely. It's amazing to me that there's so many ways that we can do things to help each other, and uh, technology is just, it's floored me. I was so not involved in anything like this before before I
Yeah,
got sick.
right.
It was not where I was headed. And it's been amazing to see all of the study opportunities, all the
Right.
research coming
Yeah.
out, all of the support groups and the Brookline, and all of the ways that you can kind of interact. It's phenomenal. It's really amazing, but it is important to protect yourself,
Yeah.
your energy. If you are energetically limited, and it's hard for you to like finish sitting through an appointment, or continue fighting with one doctor, it is. rest is good. It's
Yeah,
okay to
it's okay
tap.
to take a break. Yeah, tap out. Tap. Somebody else tap in. Come back in when you're
Right,
ready. So,
right. Got this.
well, we are at an hour and we have
Good.
exhausted our bullet point here. Yay, we did
I can't
it!
believe we got through it all.
Yay! Of course we did.
That's amazing.
So if you have any questions, feel free to reach out. And if you are in need of support, like if you, yeah, we do have a support line. It's called the Brook line. That number is 844-276-6530. You can call or text 24/7. And we've got other long haulers who are glad to talk to you. So thank
Yep.
you for being here. This is Amanda Finley and the fabulous Donna Zelazny. We'll see you later.
All right. Thanks,
Bye.
guys. Bye.